Okay, good morning, everyone, or good afternoon. We are going to be discussing a COVID-19 update for employers today. And we have a lot to cover. Let's see. I'm going to switch over to the next slide. This is not specific advice for you, just general information about the state of the law and hopefully pointing in the right direction to find answers if you have questions. What we're going to go over today is up here on this slide, restrictions on operations that are currently in place, masks, vaccines, workplace safety, and COVID-19 exposures. So for those of you who don't know me, my name is Jamie Bossuat, and I am a shareholder at Kroloff and focus on employment law and business law in my practice. I help employers with a range of things from policy development and training to handling claims from employees all the way through a jury trial. So one of the things I do is give advice on workplace safety, and that includes COVID-19. So we're going to start with restrictions on operations. The slides will be available today if you send me an email. The chat disappears when this webinar ends. So if you put your email in the chat, it's going to disappear and I won't have it. But if you email me, I will send you a copy of the slides. And go ahead and insert questions into either the chat or the Q&A box, which should be open for you today. So California's current approach is here. They are encouraging vaccinations, encouraging masking, encouraging testing for anyone who feels ill and requiring testing in certain sectors, and then having some additional rules for vaccination or testing for what is considered to be mega events. So the closures, the blueprint for reopening, the color-coded county tiers, that has all basically disappeared at this point in time. And these are the current state recommendations. And we're going to go through some of these in more specificity relating to the California Department of Public Health guidance, for example. So what is required in terms of masks? This is a big question I get. Down there at the bottom, you'll have the link to the California Department of Public Health website. So the most recent guidance we've received on this was effective July 28th, 2021, where the California Department of Public Health recommended but didn't require universal masking indoors. So when we say universal, we mean for both vaccinated and unvaccinated individuals. Now, the state does require masks in certain situations, such as public transportation, indoors in schools and childcare facilities, in emergency shelters and cooling shelters, in healthcare settings, in correctional facilities, in homeless shelters, and long-term care facilities and senior care facilities. So masks are required for all in those settings and recommended for all indoors elsewhere. California no longer has a travel advisory in effect, and there is no current state mandate to test and quarantine before or after travel. The CDC, the Centers for Disease Control, the Federal Centers for Disease Control requests, but doesn't require, that people be fully vaccinated before they travel, or if not fully vaccinated, receive testing before and after the travel, and also wearing a mask while on public transportation or in a public transportation hub is recommended, and on federal airline flights, for example, is required. So there is this distinction for a mega event, and that includes more than 5,000 people in an indoor setting or more than 10,000 people in an outdoor setting. So beginning on September 20th, the state is requiring attendees to confirm with proof of vaccination or a negative COVID-19 status in order to attend. So we have this test or vaccination documentation requirement now. Previously, for mega events, prior to the most recent order, a self-attestation of vaccination status was sufficient, and that is no longer the case. Oh, I have a note from someone. It just changed to 1,000 or more for indoor events. It's updating very rapidly. If you're holding a large mega event, what I do recommend is that you check the California Department of Public Health website frequently and often, because it is changing rapidly. And the 10,000 or more people was the last time I checked on outdoors. So mask requirements in non-mandatory settings. So for example, in a local business, it's okay to allow patrons to self-attest that they are in compliance prior to entry. It is okay to implement a vaccine verification for your business. It's also okay to require all of your patrons to wear masks. So these are discretionary items for businesses in California. Now, there is a must, which is that if someone wants to wear a mask in your place of business, you have to allow that. There are exceptions to all of the masking requirements, regardless of location. That's children under 2 years old do not have to wear a mask because they aren't able to remove that if they aren't breathing properly and there's a risk of suffocation. Similarly, people with a medical condition, mental health condition, or disability that prevents them from wearing the mask, including if they can't remove that mask with assistance. Persons who are hearing impaired or communicating with someone who is hearing impaired and seeing their mouth is necessary to communicate have an exception. And then persons for whom wearing a mask would create a risk to the person due to their work. And this would include if the mask was to become wet or something else like that, depending on the type of work. So Cal OSHA has workplace rules for masks as well. We're going to go through more workplace rules later, of course, and that's going to be a large part of this presentation. But right now, unvaccinated employees have to be provided N95 masks for use indoors by their employers. Employers have to allow face coverings for those who choose voluntarily to wear them. And employers do have the option of mandating face coverings so long as they accommodate those who may not be able to wear one due to a disability. Also, we see county mask mandates in place for about half of the state at this point in time. And these came into effect in early August for most of these locations. We don't have one currently in place for the county of San Joaquin, and they didn't follow suit very closely after these other counties put in a mask mandate. So we'll have to wait and see as the COVID-19 pandemic progresses in our area. If that changes, again, you're always going to be wanting to check both the California Department of Public Health website as well as the County Department of Public Health website, because those are the ones that are controlling which regulations apply to us. Now, if you have employees in these settings, it's important that you know that there's a mask mandate. Alameda, Contra Costa, Marin, San Francisco, San Mateo, Santa Clara, Sonoma, the city of Berkeley, Sacramento, Los Angeles, and Yolo all have current mask mandates. Okay, so that is my section on masks currently. There's a lot of flexibility for most businesses that are operating in San Joaquin County. And does anyone have any questions about that section before we move on to vaccines? Okay, seeing no questions on that, we're going to move forward. Okay, so vaccines. Oh, click. There we go. Okay, so here's a chart I pulled down today, which indicates the doses of vaccines administered per 100,000 people. So I don't know why my screenshot picked out Mendocino County, but anyway, you can pull this down off of the California website. And this includes, and so you can see the coastal cities, the Bay Area cities, we are medium blue here under this box, have a higher rate of vaccination. A question I received, what about employees outside? Masks are not currently required in outside environments for vaccinated or unvaccinated employees unless you fit into the mega event calculations. I have a question also about healthcare providers. I have a section on healthcare providers in just a moment, and we'll go into more detail because that did recently change. So we have a couple updates that have come out in the last few days. One, booster shots are anticipated to be available to the general public in September of 2021. Second, individuals with certain health conditions that make them immunocompromised can now get a third shot of either the Moderna or Pfizer vaccines. And recently, we learned that the California legislature is actually considering a bill which would mandate vaccines or testing. I think that would be similar to what we're seeing in the healthcare setting in the private sector. So we're following that very closely, and I'm sure we will see that in the news as that progresses. So vaccination for healthcare workers is a hot topic right now. It's been tested in the courts and so far upheld. So vaccination in California right now is mandatory for those working in general acute care hospitals, skilled nursing facilities, intermediate care facilities, psychiatric hospitals, adult day centers, programs of all-inclusive care for the elderly, ANP centers, ambulatory surgery centers, chemical dependency recovery hospitals, clinics and doctors' offices, dialysis centers, hospitals, pediatric day and health respite care facilities, and substance abuse and mental health treatment facilities. So if you are operating one of these centers, your workers need to be vaccinated or covered. So who is, or tested? Covered. So who is, and there's the link to the California Department of Public Health guidance there on the bottom. So who is a healthcare worker? All workers in the facilities who are paid or unpaid, which would include volunteers, providing in a setting in which care is provided to patients or patients have access to the area in which they are working for any purpose. So for example, workers would include nurses, nursing assistants, and physicians. I think that's pretty self-explanatory. Technicians, therapists, phlebotomists, and pharmacists, they're coming into contact with healthcare workers. Students and trainees, contract staff, so not just your employees, but also workers that you hire to come into your facility. And then those who aren't involved in patient care, but who could be exposed to patients or the virus. So this would include perhaps clerical workers, dietary workers, those in the environmental services departments, those working in laundry, security, engineering, billing perhaps. Now, if they're on a non-healthcare site, for example, if you have a billing department located in a business building elsewhere, that would not fall under this. But if they're coming into contact with patients or potentially the virus from the patients, then they would need to be covered under this law. So what does it require? All workers must have their first dose of a 1-dose regime or their second dose of a 2-dose regime by September 30th, 2021. All vaccines must are covered under this. So those Moderna, Pfizer, and Johnson & Johnson, those that are approved by the U.S. Food and Drug Administration, and also vaccines approved by the World Health Organization if you have workers coming from overseas, for example. What are the exceptions? Employees who decline the vaccination due to religious beliefs or qualifying medical reasons can provide the healthcare facility with a declination form. So you're going to want something in writing expressing the reason for the declination. So those with qualified medical reasons have to provide their employer with a written statement signed by a physician, nurse practitioner, or other licensed professional working under a physician, stating that they qualify for the exemption, and then the duration that they are unable to receive the vaccine. So for example, if they're undergoing a treatment that is contraindicated for the vaccine, and that's going to go on for the next 6 months, that person can put that person is not eligible for this vaccine or shouldn't be receiving the vaccine for 6 months. They can also put that it's a permanent condition and they will never be able to receive the vaccine also. So, what is a religious belief? This question is coming up more and more. So, it doesn't have to be an express tenet of the religion, but it does have to have some religious foundation. It's something other than just a philosophy or a way of life, because religious beliefs are more protected than other beliefs. So, it does have to be tied to a religious foundation. But it doesn't have to be connected to a belief in God. For example, Buddhism would qualify. And a religion generally is something that addresses fundamental and ultimate questions having to do with deep and imponderable matters. You can tell this came out of a case. A judge came up with that. Because what does that mean? Anyway, we're trying to define religion, which is extremely difficult. And it's a comprehensive belief system rather than just an isolated teaching. So that's what a religious belief is if you're trying to decide whether someone's religious exemption qualifies. If they have a pastor or other religious leader attesting that they should not receive the vaccine, that is good indication that it's a religious belief. And what is a disability that would prevent someone from receiving a vaccine? This relates not necessarily to the healthcare exemption, which is any medical condition, but also if you are requiring masking or vaccines in your private workplace, you do have to accommodate disabilities. So, a disability is a mental or physical impairment, disorder, or condition that limits a major life activity. It can include a diagnosis of HIV or AIDS and other medical conditions, including something related to, for example, cancer. And it could be someone that's considered to be disabled. And what I like to note when we're talking about accommodations is that those who have developed COVID-19 related long term conditions may qualify as disabled as well. So, if they have respiratory distress relating to COVID-19 and are unable to wear a mask, for example, that may qualify. There's some recommendations in terms of keeping your documentation of vaccines. Beware of disability related inquiries. So, if someone has a medical condition and they have a certification that their doctor does not want them to take the vaccine, you should not inquire further. So, you should not say, what is the medical condition, and try and understand that. That's private protected information. Additionally, your vaccine records should be maintained separately as medical records. And then we should also be aware that individuals who receive the vaccine may have vaccine related side effects that may make them ill for a period of time. And there's time off provided in the law for that type of illness. Okay, I did have a question in this section that I'm going to come back to, a couple here. I'm going to go back really quick to the first slide. So the law currently requires vaccination for these healthcare facilities. So a nurse going into someone's home is not specifically covered because we have pediatric day health and respite care facilities. So this particular law, this particular guidance that I've linked to at the bottom of the screen does not necessarily cover someone going into a home. However, there are community care licensing requirements and other governmental regulatory schemes for those providing care in homes that this webinar can't cover because those are too specialized. We don't have enough time, but you'll want to make sure that you're complying with all of the different regulatory schemes that your particular business providing in-home care may be covered by. If you need more help with that, I would recommend reaching out to your counsel because going into homes, healthcare settings, et cetera, is more complex now, unfortunately, than it used to be. I have another question here. Religious concern about the vaccine due to the perception that the vaccine was developed using um, fetal tissue. That question is outside the scope of what I can go over in the webinar today. If you would like to reach out to me about whether vaccines generally are prohibited by a religion, that's something we need to look into a little more closely, but also depend on the type of workplace that you're operating and how you want to address that concern. And I have another question. A healthcare worker had her first dose, but now doesn't want to receive a second dose due to a religious belief. That's interesting. That would need to be looked at on a case by case basis. People's religious beliefs do change. They do join new religions. So that doesn't automatically mean that that can be disregarded. So you need to look in the particular circumstance of that individual. This may be another one where you want to get some advice from legal counsel. Because what we're talking about with mandatory vaccinations, it's not just whether this is a good idea policy wise, but for employers and business owners, the question you're really asking is, do I fire this person for not being vaccinated? Do I prevent them from coming to work? And so that's a really practical question you have to answer. Does the state require it? That's different for healthcare workers than for those of you in private businesses where there is not currently a mandate in which you would want to require the vaccine. Now, let's see, I'm clicking through here one more time, 1 second. The other aspect to this is if someone has a medical exemption or a religious exemption from the healthcare provider, they can continue working if they receive testing. So there are 2 levels depending on whether it's an acute care facility or not. But testing is required every week for non-acute facilities and twice a week for acute care facilities. So they can receive testing instead of the vaccine if they actually meet the exemption criteria. My concern as a healthcare provider would be, am I granting exceptions I shouldn't be granting? Am I following this guidance correctly? Am I accommodating employees as they need to be accommodated? So all very tricky and I think a high risk situation. There currently is not a lot of guidance on what you can require for religious accommodation. I have seen instances in which employees do bring in letters from their pastors or other religious representatives attesting that they are a member of the church. The California Department of Public Health guidance does not currently require documentation for the religious exemption. Now, I would recommend it, even if it's an email, some kind of documentation from the employee, a self-attestation to put in the file. That is something I do recommend, but they aren't requiring, for example, a letter from the pastor, because some people hold a religious belief but are not actually actively attending a church. So it's quite complicated actually to get through all of the aspects of those religious accommodations. Okay, I am now moving, I think I've gotten through these questions. Oh, another one. Does janitorial staff working in a healthcare setting have to vaccinate? Yes, if they are coming into potential contact with the virus that may be spread by patients because they are cleaning patient rooms, then they would be covered as workers. Okay, moving on to workplace safety, which will address the other question I received, which is refusing service to those who are not vaccinated. So California, we're going to start big picture here. California has had for many years health and safety requirements implemented by Cal OSHA. So everyone must have an injury and illness prevention plan if they have one or more employees. Also, you must have a COVID prevention plan in place now, which is mandated by some state laws that were passed in the last legislative session, and also the Cal OSHA emergency temporary standards. So if you do not have an injury and illness prevention program in place, that is something I help my clients with. There are also templates online that you can attempt to do yourself on the Cal OSHA or the Department of Industrial Relations website, which is linked on the bottom there. The Department of Industrial Relations has also provided a model COVID-19 prevention plan, prevention program. So you can go ahead and implement one of those using this template online, or if you need assistance, I can help with that as well, or you could reach out to whomever your employment counsel is. So the Cal OSHA temporary standard covers all employers, except for those who have employees working only from home. And also, if those of you who are covered by the aerosol transmissible disease standard are not covered by the Cal OSHA temporary standard, because you have to follow the ATD standard. We've got a revised emergency temporary standard from Cal OSHA on June 17th. And this is the kind of a summary here. I'm going to go through exclusion and isolation in more detail in a minute. And um, there is no face covering requirement outdoors in the temporary standard. You have to provide the masking. We went through that. And physical barrier requirements have been reduced or eliminated. But you do have to have that written COVID-19 prevention plan and take reasonable steps to protect your employees in the workplace. And so looking to what is a reasonable step, there's a lot of information out there on air circulation, ventilation, filtering, also cleaning. So those are all things that you would want to consider and include in your plan. The model plan includes some of those for you already. You do have to respond appropriately to outbreaks and infections now. An outbreak is 3 or more cases in a 14-day period. A major outbreak is 20 or more cases. If you have an outbreak, you do need to contact the local Department of Public Health. They're going to give you guidance and instructions, and that's going to alter your exclusion requirements. I don't have time here today to go through exclusions for outbreaks. That is an area of pretty high liability and risk. So I would recommend that you reach out to your counsel if you have an outbreak. You do have to provide testing to your employees at no cost if they're exposed in the workplace. You have to notify the local health department within 48 hours of an outbreak. You have to maintain records of COVID-19 cases in your workplace, and you have to report serious injury or death to Cal OSHA, which is always the case in California. These are the elements of a COVID-19 prevention plan. You have to have a system for communicating with your employees. You have to take time to identify, evaluate, and correct any COVID-19 hazards in your workplace. Implement face coverings where necessary, also where optional if you want to do that. You have to put in place engineering and administrative controls. Although the social distancing requirements in California were lifted when the state reopened, that doesn't mean that you don't have to take any steps to protect your workers from transmission in the workplace, especially when you have customers. So we see those plastics and stickers on the floor for spacing, etc. You have to have procedures in place to investigate and respond to cases. We're going to go through that in more detail in a moment because I know that's a current question that's coming up a lot more. You have to train and instruct your employees on the virus and how it is transmitted. You have to provide testing for unvaccinated employees who are symptomatic. You have to take appropriate steps to exclude those who have been exposed to stop the risk of transmission in the workplace, and you have to maintain appropriate records. I have a question here. Can I require employees to wear a mask? In California currently, yes, that is your option if you would like to do that. Another question, do I have to take temperatures and ask symptom questions of employees? So although California has lifted some of those more stringent requirements, that is still a step that you can take to make sure that your workers are safe. So that's a lot of employers are using that in their COVID-19 prevention plans. And if you have a workplace where you have a lot of people coming and going, then that is something that could be recommended to demonstrate that you're taking appropriate, reasonable steps to protect your workplace. So a lot of employers are still requiring that. Also, in schools and daycare settings, there are more stringent requirements as well. So you want to make sure that if you are operating a licensed business, that you comply with any, for example, community care licensing requirements. 1 second. Outbreaks are in a based on location. So you have, if for example, you have an office in Sacramento and an office in Stockton, they don't interact. You would have to only address the outbreak in one particular facility. Do we have to provide N95 masks if we require them? No, it is recommended that if you require masks, you do make them available to your workers. I'd say that is pretty standard at this point, and that would be my recommendation. If But you do not have to provide N95s. The 2-layer surgical masks are sufficient, except for your unvaccinated workers. The current emergency standard does require that unvaccinated workers have N95s available to them at their election. Okay, more questions. Do you have to, report all employees who test positive to workers' comp? Yes, we're going to get to that in a moment. Okay, I've fielded all the questions so far, so we're going to move along. This is Cal OSHA Log 300 recording requirements for you, those of you in high hazard workplaces. If you have questions about Cal OSHA hazard reporting and whether or not you qualify, that would be a question for council at this point in time, I think, to bring you into compliance with that. Reporting requirements are different from recording requirements. Those of you in high hazard workplaces are familiar with this. You have to report serious injury, illness, or death within 8 hours to Cal OSHA. That's an inpatient hospitalization if the employee became sick at work, or if it was work related and they became ill at home. So here's the work related criteria for those of you that this applies to. And you must report even if the COVID-19 is not yet diagnosed. So for example, someone has been exposed to COVID-19, is experiencing COVID-19 symptoms, has been hospitalized, and they're waiting for their test result, or you're waiting to hear back. That would still need to be reported. Workers' compensation reporting is required for all positive COVID-19 results of your employees, regardless of whether they contracted it in the workplace or at home. So there is a presumption in California that the transmission was workplace related. Usually, or I don't want to say usually, sometimes that's not the case. We have employees who their husband was exposed at work, they were exposed at home. It's very clear where the exposure came from. There has been no other exposure in your workplace. That still has to be reported to workers' comp. I think maybe all workers' comp carriers now have online forms where you can do that reporting. You would want to take your steps to document why you didn't think it was work related, which could defeat the presumption for workers' comp benefits. You need to report that within 3 days of the positive test. And provide some additional information, which is all now included in forms. 48 hours of reporting to the local health departments. We've already covered that. And this slide does mention that it's the same work site. So if you have a COVID-19 exposure in your workplace, you have to provide written notice to all employees, subcontractors, and independent contractors who were at the work site within the infectious period. We'll go over what that is. It's 48 hours prior to the onset, and who may have been exposed. So you also have to provide notice to certain representatives and unions. And you have to provide information on COVID-19 benefits that employee is eligible for, including workers' compensation, COVID leave, California's COVID paid sick leave supplement, and also the company's anti-discrimination, harassment, and retaliation policies. Also, you have to provide notice of what disinfection protocols you're using, and that has been evolving in the last few months. So do check the CDC website for recommendations on cleaning and disinfecting if you have COVID-19 cases in your workplace, because they have changed. I don't have time in this presentation to go over all of that, but the CDC website is where you're going to go for that information. Also, for workplace safety, one of the things you can do, of course, is encourage vaccination. California, I just like to note this because California does have an employer vaccination toolkit where they provide resources for employers to help their employees become vaccinated, including clinics, support, handouts, all sorts of information. So if you want to provide that kind of information to your employees or potentially set up some kind of vaccination opportunity for them, this is a website that you can go to get that started. Okay, the next section we're going to go through is what to do if there's a COVID-19 exposure in your workplace. I have a couple questions here. 1 second. Workers' comp reporting is required for any employee you have that has a positive COVID-19 case, regardless of where they caught it. If an employee, okay, we're going to go through COVID pay in a moment. Can you require individuals to show a vaccine card? Yes, you can. Okay. I'm going to start this next section, which is going to answer some of these lingering questions, I think. So here we go. What is a close contact? When you're trying to decide if someone was exposed, that's very important to you. So it's being within 6 feet of someone who has COVID-19 for a collective 15 minutes in a 24-hour period during the infectious period. So the high risk infection period has remained the same for a while now. It's 48, well, except for I made a typo on my slide, 48 hours before symptom onset or the positive test result if there are no symptoms, and until the employee is cleared to discontinue isolation. So Susie comes into the office. Susie has on Monday. On Wednesday, Susie is diagnosed with COVID-19. She has a positive test result, no symptoms. We look back and we say from the date of Susie's positive test, she was infectious for 48 hours. So Susie tested on Tuesday, got her result on Wednesday. So Susie was infectious on Monday and Sunday, the 48 hours before the test. And so anyone who came within 6 feet of Susie for a collective 15 minutes in a 24-hour period is a close contact. So if Bob had a 15 to 20-minute meeting with Susie in her office about 4 feet away from her, Bob is a close contact and has been exposed. If Adam came into Susie's office 3 times for 5 minutes on Monday, he had a collective 15 minutes of exposure. He's exposed. He requires notice. If Susie passed someone in the hall and with just a brief contact, that is not a close contact. Okay. So what are the isolation requirements? I have someone in my office who has tested positive for COVID-19. We're calling her Susie. So Susie must isolate. She can't come to work. She can't continue to expose people because she's considered to be infectious. She can only discontinue those isolation precautions 10 days after her symptoms started, and with her fever relieving for at least 24 hours without the use of fever reducing medications, and if her symptoms are improving. So Susie was asymptomatic in our last case, so that would be the 10 days for her. If Susie developed symptoms, started having a cough, started having a fever, we wait for 24 hours after the fever resolves, and we wait for the cough to improve, and we wait for the 10 days. So all of these things have to happen for someone to return to the workplace. And these recommendations are based on studies of the infectious period and the course of the illness. So typically people do have resolution of fever, resolution of symptoms within 10 days. So often people are returning within 10 days. Now, those with a more severe illness may need to extend the isolation precautions for up to 20 days after symptom onset. And that's at the recommendation of their healthcare provider. So if you have someone with a serious COVID-19 case who is receiving medical treatment or who has been hospitalized, you may want to request a medical note from them about when their provider recommends that they end isolation. Because this is not a fixed period of time, it's not a fixed 20 days, and getting the recommendation of the physician is a good way to protect your other employees. Now I'm going to go on to the next slide and then take more questions. So that's isolation. Isolation relates to someone who actually has COVID-19, has tested positive for it, or has COVID-19 symptoms. Quarantine is for those in your workforce who were exposed to someone with COVID-19. So they may not necessarily have tested positive, they may not develop symptoms, but they could be infectious. So they are expected to quarantine, and you're expected to remove them from your workplace. So unvaccinated employees with a close contact have to be excluded for 10 days since their last contact. Now the problem is if Susie was exposed by Bob. They're living together. She is not separated from him in the home or hasn't moved out. Until Bob is done with his isolation, Susie is continuously being infected. So that's going to prolong this, even if Susie doesn't test positive herself. If Susie develops symptoms, then she begins following the isolation protocols herself because she's considered to be an infected individual. Exceptions do exist for periods of critical staffing shortages in healthcare and social service settings. So we saw that a lot last year, and you want to, I think, consult counsel before reducing these quarantine periods due to staffing shortages. Fully vaccinated employees have slightly different rules. They don't need to be excluded unless they develop symptoms. However, it is recommended that those individuals wear a mask while in the workplace. Also, employees with a positive COVID-19 case in the last 90 days are considered to have antibodies, even if they weren't vaccinated. So they also do not need to be excluded during that 90-day period, but they should wear a mask. Okay, now we're going to go into some of the leave benefits that are available. So I'm going to ask if there are any questions related to isolation or quarantine at this point in time or close contacts in the workplace. One second, I'm just checking the questions. Oh, this relates to COVID. Okay. You have to, you telework. I don't remember the answer to this question off the top of my head. If you email it to me, I will look it up for you. Question is, if you have a telework employee, do you have to report that positive test? I believe the answer is no. I'm remembering as I talk, because that person was not in the workplace. But that's something I would need to double check. Oh, fraudulent doctor's notes about exposure. That is a different question about whether you can call doctor to verify. That is a tricky situation contacting doctors. It's not typically recommended, but if you have a reason to suspect fraud, then there are steps that you can take. I would recommend that you seek counsel on that issue if you're concerned about fraudulent doctor's notes. If an employee hears that someone they worked with has COVID-19 symptoms and is tested positive, but the other employees don't have symptoms, are they required to quarantine? This one I need a little bit more information to answer. So with anyone who has a potential exposure in your workplace, what you're going to do is go through that series of steps. You're going to say, when was the exposure? What was the infectious period of the person that introduced the virus into the workplace or to your workers? And you're going to count backwards the 48 hours to determine who had a close contact. Those individuals need to receive the notice that we discussed a few minutes ago and need to be excluded from the workplace. So just having worked with someone is not sufficient. They need to have that close contact. Now, I do have a lot of employers that send out notices to everyone. And they say, for example, we had a COVID exposure in our workplace. We are taking care of it. You don't need to worry. You will be receiving direct notice if we think that you were exposed. So this kind of stops the rumor mill to some extent. That's a case-by-case basis, depending on your workplace. It's a business decision. It's not required. But I do have employers that send two notices, one to those who are exposed and one to those that are just in the workplace and may hear a rumor that there was a COVID exposure. Employees who don't see clients who are working only at home, do you have to report a COVID case to the workers' comp carrier? I don't remember that. If you could email me that question, that would be great, because I just off the top of my head can't remember that. I had it memorized when the rules initially came out. If an employee is exposed at an event being hosted off-site, are the requirements the same? Does the facility you're using have any responsibilities? So yes, if you have an employee exposed by a customer, consumer, anyone, if you're aware of an exposure, you have to follow these protocols. Does the facility have responsibilities? Yes, it has its own set of responsibilities to notify its employees it's independent contractors. If your worker is working on someone else's site, they would be an independent contractor, and that facility should notify them. But I also recommend that you take the steps to notify as well. Who knows if they're doing it correctly. Um, can you discipline an employee who comes to work with symptoms, not wearing a mask, but then doesn't tell anyone until days later? Yes, you can. If you That would be a violation of your work rules, and you can always discipline someone for violating your work rules. So what you want to look at is that you have a COVID-19 prevention policy in place, that that policy is clear and has been communicated to the employees. And then a violation of it would be a violation of any other workplace rule, like a violation of any other workplace rule you have. If this person is continuously coming to work late, would you discipline them? Yes, you would. If they're coming to work and violating your COVID-19 rules by coughing on people, yes, you would. So again, that's just like any other discipline, but I do recommend you have those policies in place that you can then enforce consistently. 15 minutes of exposure with or without a mask is the question. The Cal OSHA rules and the legislation that has been passed thus far does not differentiate between masked and non-masked employees in terms of exposure. So that doesn't matter. But does point out the 6 feet thing does make a difference. So even though California lifted its social distancing rules and its rules about all of these different 6 feet, if you keep your people 6 feet apart, you're not going to have a close contact as often as if you let them congregate in groups. So if you're talking about keeping your workplace open, running smoothly with all of your staff healthy, those protocols that were initially recommended by the state when we reopened are going to help you do that. What is the difference between a cough and an improved cough? That's a question for a healthcare provider outside of the scope of this webinar. It really, I think, depends on an overall improvement of symptoms. So some people that have a serious COVID-19 illness do continue to have a cough for a long period of time. If there's resolution of other symptoms, then they're going to be able to return to the workplace. You can always request a medical note if someone has a severe case of COVID and is coughing and you're concerned about bringing them into the workplace. You cannot require a negative COVID test to return to the workplace. The reason is that those that recover from COVID-19 have sometimes test positive for a longer period of time than they are infectious. So a negative COVID-19 test result is not permitted in California at this point in time for those who had COVID-19. But you can require a medical note to clarify when this person is no longer infectious. If someone was exposed in the prior 48 hours and they are fully vaccinated, must they quarantine? Currently, no, they do not need to quarantine, but it is recommended that you have them wear a mask in the workplace. What happened October 1st with supplemental paid sick leave? We're going to get to that. I don't know. We're going to find out. I'm scrolling down through more questions. Can an employee telework while in quarantine? Yes, they can. If an employee is able to work remotely, you can ask them to work remotely. Now, if they actually have a COVID-19 diagnosis, they might be too ill to work remotely. In that case, some of these leave benefits we're about to go through are going to come into play. This question is about on the road employees who tested positive and whether or not they count as an outbreak because they were not at the central location. I don't know that answer to that question off the top of my head. The county health department would be the place to ask. They do have some guidance and informational materials up on their website. There's also guidance on what an outbreak is on the California Department of Public Health website that goes into a lot more detail about what a facility means, what a workplace means. Or you could reach out to your council for more specifics on that issue. I have a question about what happens if I have an individual that is required to be vaccinated because they are a registered nurse and they refuse. So what you would do is first determine whether or not they meet one of the exemption requirements. Do they have a bona fide religious belief that prevents them from receiving the vaccine? Or do they have a medical condition that would prevent them from receiving the vaccine? You'd get documentation. If they don't have either of those and they simply refuse to take the vaccine, then you are facing significant liability for bringing them into the workplace where they are in contact with patients. Perhaps there is a position you could transfer them to, that would be at your election, but you could terminate the employment if they cannot do their job because they cannot meet the state requirements for doing their job. So they could voluntarily resign in lieu of getting the vaccine, or you could discharge them. We don't have much guidance at this point on time on what that would be. If work is available, unemployment makes a decision about whether work is available and they declined it. So we had a few months ago people returning from furlough who didn't want to return to the workplace. They didn't feel safe. And so the question was then, what do I put on my unemployment paperwork? And if the employer has sufficient safety programs in place and there isn't a disability or health condition that would make that person much more at risk, it's likely that they're going to be denied unemployment because the EDD would consider that they had work available that they declined. Okay, California COVID-19 supplemental paid sick leave. It covers employers with more than 25 employees. So this doesn't apply to you if you have 25 employees or less. It was effective January 1st and it goes through September 30th. It provides 80 hours of COVID-related sick leave and a pro rata amount for part-time employees. It follows the FFCRA federal law that we saw put in place in 2020. It has to be separately listed on the pay stub. There's prohibitions against discrimination and retaliation. There was a grace period in place until March 29th, but it is also retroactive. If an employee took time off, they can have this applied for that time prior to its effective date. You have to post a notice for this. There's a very nice FAQ up online as well. Links are there for both of those for you. If an employee is unable to telework, they are qualified for it. So if they can telework, then they don't need to receive the California paid sick leave. This would be based on their own condition, care of a family member, or vaccine related. The details are on the slide there for you, and I do recommend that FAQ. You do have to make sure that you pay them properly for the paid sick leave, which is the regular rate of pay. That's not their flat hourly pay necessarily. Also, if they aren't being paid the minimum wage due to maybe a housing allowance or something else, that has to be paid at the minimum wage. You can also average the hourly pay for the preceding 90 days. And exempt employees can be paid at the same rate of pay they're paid for other types of their paid leave. This is all on the FAQ as well. I'm going to skip through here. Families First Coronavirus Relief Act. This was expanded through March 31st and then expanded again through September 30th through various federal laws. It also added additional reasons that you could take the leave that were initially in place in 2020. Also, it refilled the 80 hours of paid sick leave as of April 1st. That would be for the employee's own illness. There was also a secondary portion of this law, the Expanded Family Medical Leave Act. That did not get refilled on April 1st. If the employee ran out of that leave previously, they don't get more allocation. Now, of course, this law allows you to receive reimbursement out of your tax liability for your federal employment tax. Most of the large payroll companies now have that set up where you can check the FCRA boxes. They have a series of them depending on what the person's type of leave is, and they automatically allocate that for you. This is at this point in time voluntary. So you do not have to provide this if you do not want to. However, if you were covered by the 26 or more California paid sick leave, this does offer you an opportunity for some reimbursement. However, we are recommending at this point in time that you provide the whole FFCRA leave. We believe that to be the intention of the law. So if you want to provide the sick leave, you would also be providing the EFMLA if you opt into this program. Now, will they continue it again? I don't know. I think that does seem likely on a federal level as a voluntary program, and also on a state level. I think it's even more likely. The state did allow their program to lapse in December for the equivalence of the FFCRA. So we're just going to have to wait and see what happens with that. But it is available right now through the end of September. The what I was going to say no longer applies. So moving on here, here's the reasons for FFCRA leave that are available. Um, your own illness, caring for someone with COVID-19. We have added to this caring for someone with vaccine side effects, receiving a vaccine, awaiting results of a test. So this would provide reimbursement for you and pay for the employees out of that. Now, there are also COVID-19 local sick leave laws that you should be aware of if you have employees working in these cities: Long Beach, LA, Oakland, Sacramento, San Francisco, San Jose, San Mateo, Santa Rosa, and Sonoma County have their own local sick leave laws in place. So you want to look those up and make sure that you're paying those appropriately if you have an employee working in those areas. I'm just going to skip to the Q&A here. I'm going to go because we have some more questions. 1 second. What happens October 1st with supplemental paid sick leave? At this point in time, it goes away. The obligation to provide it goes away. However, it may be extended. Also, you still have your regular California sick leave that would cover an absence due to COVID-19 or COVID-19 prevention. I have, okay. I have an employee going to be out for 16 days. Is he only eligible for the 80 FFCRA hours? If it is a COVID-related reason for being out, then the 80 hours is what is available for his own illness. If the doctor has recommended, for example, a 16-day absence to recover from COVID-19 before he can return to the workplace. So yes, he would run out of those hours. He then has the option to use other paid sick leave that you have available, to use vacation time, to use PTO, potentially also to apply for California state disability benefits. If it's a severe long-term illness that may qualify, or if he's caring for an individual who has COVID, for example, a child, the paid family leave program in California, which is run through the EDD, may provide a benefit. There is a website and a chart on the EDD website that provides a list of all of the different types of available benefits. I do recommend that you take a look at that if you have an employee trying to piece together compensation for a prolonged illness. I also do recommend giving that out with your notices to employees who have been exposed. It does reassure them, and it does give them information about their available options. Is there a supplemental paid sick leave requirement for business under 25? The requirement for businesses under 25 is that if the exposure occurred in the workplace, you have to pay the employee for the time that they are excluded from the workplace. We call it exclusion pay, and that's part of the Cal OSHA emergency regs. And that pay can be offset by other types of pay you have, like sick leave or state disability pay. Or you could voluntarily opt into the FFCRA federal program to make sure that that employee receives compensation. There is a website on the Department of Industrial Relations, if you want to check that out, that does have information about exclusion pay and what can be offset against it. But that would only relate for those of you with 25 or less to exposures that occurred in the workplace. If Susie was exposed by her husband at home, you would not be required to pay exclusion pay under the Cal OSHA regs. FFCRA is pro rata for part-time employees, yes. Okay, let me get my Q&A back open. 1 second, I'll answer all of the questions that you have. I can hang around even though we're out of time. Oh, I don't have any in the Q&A. So if you have any other questions, please feel free to send those to me. I'll hang around for another minute or so. If you have questions, you can also reach out to me. I can answer more individualized questions for my clients. I can help you with all of these documents that are needed. But that's one of the services we provide for our clients at Kroloff. If you would like a copy of the slides, that's what I was trying to say. Go ahead and send me an email. My email is there on the screen, and I will provide you with a PDF of the slides. I'm getting more questions. One second. Okay. Also, question, can we get a copy of the recording? Yes, you can. That is going to go up on our website probably next week. So you can check for that. We have a video link on our website with a lot of videos actually that we've recorded on different topics. I have a bunch on employment law. We also have some on estate planning and other practice areas that we cover. So you can check that out, and this video will also be up there. If COVID continues and we are forced to shut down, will we revert to the old rules? Um, I wish I had a crystal ball. That one is hard to answer. It depends. I think it's unlikely that there would be another shutdown similar to the one we encountered in early 2020. And that's because there is so much more information now out there about how the virus is transmitted, how we can prevent it, and how it can be treated. And we now have vaccines. So I don't think we're going to revert to what happened last year. Would we see more mask mandates? Perhaps. That's what we're seeing in about half of the counties throughout the state, because masking has been proven to reduce transmission. Will there be more social distancing requirements? Perhaps. The research is evolving on that. I do anticipate that we will see some developments in the areas of boosters. If those are widely available or recommended, and how the testing goes on those, we might see our vaccine requirements updated. We might see more vaccine requirements. As I mentioned, there's a bill pending right now that could require vaccines in private workplaces with some exemptions. So I think all of that is going to evolve, but a shutdown appears less likely at this point because we have so much more information and resources now. Okay, I don't see any more questions. I think I've answered them all. If I skipped your question, please feel free to reach out to me by email, and I will try to answer general information that's sent to me that way. I can't answer specific questions without having a lot more information about your workplace. But feel free to email me for the slides, and thank you all for attending. Hopefully this was helpful to you.